For 12 months, the state's Rural Ambulance Services Task Force met and engaged with stakeholders all over New York to identify solutions to the problems facing emergency medical services in rural communities, which account for about two-thirds of the counties in the Empire State based on federal standards. To discuss the report on rural ambulance services, we're joined in the Capitol Press Room studio by Michael Benenati, Vice Chairman of the Task Force and an Ulster County EMS Coordinator. Thanks for making the time, Michael.
Thank you. Pleasure to be here.
And we're also going to hear from Aidan O'Connor, a Task Force member and Executive Director of the Greenport Rescue Squad in Columbia County. Welcome to the show, Aidan.
Greetings. Thank you for having us.
So, for starters, how would you describe the current rural EMS landscape in terms of reliability? For example, are emergency medical calls getting answered in a timely fashion to the best of your knowledge?
So I would say that currently the situation is strained, and certainly it varies across different areas of the state. But specifically in the Hudson Valley, we do have a significant gap, and we do see that there are extended response times and agencies that are unable to assemble crews and respond in a timely fashion.
And are there commonalities in terms of where the problems exist? Is it primarily in areas that rely on volunteers? Is it in areas that use for-profit private companies? Is it the areas that are lucky enough to have a municipal operation? What do you see, if any, in terms of recurring trends?
Yeah, some of the things that we're hearing, I'd say, is the most rural parts of New York State. So I'll say that even during this task force, when we met with people, we had guest speakers. Some of the things we heard was to move one patient from a rural hospital to a more tertiary definitive hospital, it could take 3, 4, 5 days to get an ambulance to move those patients because they're surrounded by agencies who are volunteer. These are, individuals who have day jobs. The only thing we are hearing is that one 911 call today for trouble breathing could take about 2 or 3 ambulances being requested and waiting for that third or fourth to say yes. So a combination of both rural and still having volunteer EMS out there.
And I think it's interesting that you point out that the EMS landscape is not just about 911 calls, it's also about some of these other transportation duties that people might not think of. Your report outlines a number of challenges facing the delivery of rural EMS, and some of them are obvious and things that we've covered on the show, and we can get into them in more depth later on, such as a lack of volunteers, limited access to public funding, and inadequate insurance reimbursement rates. But I was also struck by some of the problems highlighted in the report that had never at least been on my radar in the past, such as an absence of performance standards, the influence of New York State's home rule governing structure, as well as a lack of transparency for EMS agencies. Can you comment on how any or all of those contribute to EMS reliability concerns?
Well, I think that they're all different in their own fashion. When you talk about performance standards, today there are no performance standards for ambulance services to respond on calls. And so a volunteer ambulance service who doesn't have the ability to crew to go on the call, there's nothing held against them for that, and the performance then just declines, and it declines more over time. And so, as Aidan alluded to, then that call gets passed from agency 1 to agency 2 to agency 3. And if that cycle doesn't pick up quicker, then we have a delayed response for them. And so we really need to have response standards that are affiliated with ensuring that we have reliable EMS. We also have some EMS agencies who choose not to go to certain addresses within their response area. And that's things for like nursing homes, as an example, or tertiary care facilities, right? And then the ability to move these patients from hospitals to hospitals. And so that creates a real void in the system.
And just to mention that we went in the task force with a carrot versus a stick perspective. We have no standards today. So when we build out those standards, to Michael's point, we want to make sure that there's the funding mechanisms, there's long-term sustainability, there's a workforce part of that to make sure that when we do adhere to these standards, hopefully one day we're ready for it. But just to give you an idea, right now, any ambulance service in New York State is not required to go on a call in their district today. And then the amount of time it takes for them to go en route to that call, there are 0 standards.
And what about the home rule governing structure? I mean, I know about home rule and how it impacts the state legislature and requests for bills, but what does that mean for rural ambulance providers?
So I think the challenge just is that people are interested in being able to provide the service at a local municipality level. Now, what we have to remember, though, that villages, towns, and cities, as well as counties, are included as part of that home rule makeup. Many people think that it's that the smallest portion of the government for that municipality is in charge. But it creates barriers for system efficiencies. And so the consistent theme throughout the paper is that we need a county or regional approach to EMS. There are not enough efficiencies, operational efficiencies, at each local municipality level. Every municipality does not need to have their own ambulance service and cannot even afford to have their own ambulance service. And so we need to look at home rule really from a county perspective to ensure that we can provide this service, which is a cost equal to everybody in the county. We see variations in municipalities from $40,000 maybe a year. Some municipalities aren't contributing anything, up to $2 or $3 million. And we need to take that and spread that across the county, because we shouldn't have ambulance resources that are sitting because we don't have the workforce to even staff those vehicles. And so that's where the challenges of home rule come into play. And we need to break that down and say home rule includes county operations and county coordinated services.
Well, before we move on, let me reintroduce both of you. For listeners just joining us, this is WCNY's The Capitol Press Room, and we're speaking with Michael Benenati and Aidan O'Connor, who are members of the state's Rural Ambulance Services Task Force. So in terms of solutions, though, what could be done in the short term? Obviously, there's probably some long-term stability things that we can talk about, but for the here and now, what would you be looking for from either state policymakers or maybe even local governments?
Yeah, first and foremost, we want the task force to come back together. So we concluded this roughly about 2 years ago, and now the report is out. It's gaining traction. Thank you. We're getting the voice behind the report done right now. But I think if we bring the group back together, we need to really move on how to put this into 4 concise buckets. What is the financial ask? What is the legislative ask? What might need to be pushed to the federal level for solutions? So I'd say the first thing we're going to be probably coming forward to is to say, can we continue the task force work? Bring us back together to get to the next step. After that, I would say our counterparts would all agree that it's financial in nature. We need to find some sort of sustainability around the financial. I'll go on a little bit of a sideways motion here, which is we are a mix of public safety and healthcare. So healthcare, we got the fee for service, just like our hospitals, just like our ERs, just like our doctor's offices. But we're also part of the public safety, which is the fire departments and police who pay for readiness. So we're kind of stuck in this middle where the fee for service in rural environments, there's not enough patients to have the total amount of Medicaid, Medicare needed. So we need some readiness. Whatever that blend looks like in the coming months before the budget is completed and the Senate and the Assembly are out of house, we need to figure out how to put that onto legislation.
And I imagine you also would like to see an increase in the reimbursement rates for those fee-for-service models, right?
Absolutely. I'd say all of our counterparts are pushing for a Medicaid increase without a doubt. We're lagging way behind. If you look at all of the surrounding states, Vermont, Massachusetts, Connecticut, New Jersey, and Pennsylvania, we are the lowest EMS reimbursed at the Medicaid level.
And what about a long-term solution? I mean, you obviously can't get volunteers overnight. So are you primarily looking at that as a long-term answer? And are you looking to volunteers as the solution? Or is this an answer that is only going to come with paid professionals providing the EMS work in rural communities?
Well, I'll start and then I'll hand it off to Michael by saying, we talk a lot about volunteers in our task force report findings. But what we want to do is say thank you to all those who have volunteered. They saved the taxpayers millions and millions of dollars to get us where we are today. They saved lives to get us to where we are today. So we are very thankful for our past, but we have to start looking towards the future. And I'll hand it off to Michael for that.
And I think one of the important things is when you look at EMS as a system approach, there are several different layers of that. There's EMS first response. Well, first of all, there's calling a 911 center and public safety answering points, or PSAPs, providing and gathering information from the patients. So where you can provide pre-arrival instructions, we can provide instructions for choking and childbirth and CPR. And we can then start the emergency medical care right there from the caller's perspective. The second component of that is first response, right? And that first response can either be a local fire department or a police department or a highway department or some other public service that can get to the patient in a relatively quick amount of time and deliver life-saving care. We then want to see that followed up by BLS, basic life support, ambulance transportation capabilities, which can also be volunteers. And they can then begin to provide some of that care and additional care that they've been given over the years. EMTs in this state have additional training and adjuncts, and they can do epinephrine, they can do CPAP, they can do albuterol, they can do cardiac monitoring. So there's a variety of things that we've added to the EMT's scope of practice in New York State, which really helps us to get them care early. And then there's advanced life support by advanced life support or paramedic providers. Most often that then needs to be provided by somebody who's doing this full time. While there still are volunteer paramedics, it's a huge burden these days. So a blended system of volunteer and career folks is absolutely, the way to go in the future. But we need to realize that not so many folks are volunteering today as they have in the past, right? Our lives have changed, and it's a completely volunteer system is really just not sustainable.
Well, finally, Michael highlighted the sort of disparate systems that can exist from one county to another. So why isn't the answer to this simply making this a state-mandated service and make the state responsible for overseeing it and administering it and ensuring that everyone has access to the same level of reliable care?
So I think to start, the biggest challenge, right, is that people don't want the state coming in to provide it. Every county operates independently and has their own needs. The state doesn't necessarily know how to fix the county's problems.
But they could do it in collaboration with local leaders.
Absolutely.
And I imagine there's counties that don't have good service that would actually encourage the state to get involved.
So absolutely. And so what we're doing right now is from the governor's last budget is we are now requiring counties to provide a comprehensive report of the state of emergency medical services in their county. But it needs to happen. That needs to happen at the county level. That needs to have county flavor, right? And the county needs to identify their weaknesses and their strengths and what they think their solutions are, thinking outside of the box, looking at that. And then, yes, absolutely, we need state infusion of legislative support and financing to then help us get there. The counties can't afford it, especially our rural, our super rural, and our frontier counties. And we can't forget about those frontier regions. We have counties that don't have a hospital. And so we need to consider all of that stuff. And one of the things in the paper also talks about access to critical EMS, similar to our critical access hospital system. And that would all be significantly beneficial. But I think it really needs to happen at the county level with strong support from the state and encouragement from the state.
I think a lot of it, to your point, though, the standards will come from the state level after the support has already been invested. And you'll hear a lot in the task force. It's about the county level. So I think if the state passed a few things, they also had the standardization that's required both of paid and volunteer. I think that would be the collaboration we need between the county and state to get to where we need to be, which is a high-quality, stabilized system that responds to 911 calls within this amount of time and responds to hospital-to-hospital care within this amount of time.
I think one of the other challenges, too, is a municipality, a town and village and city can form an ambulance tax district in New York State. A county cannot form an ambulance tax district similar to a special district, similar to a water district, a sewer district, a light district. And legislation which allows counties to form an ambulance tax district would really enhance the county's ability to provide the service. And because otherwise right now the only way the county can tax is a general tax across all residents, and it's not equal even within the county, right? Because we have cities who may have a career fire and EMS agency already, and so they would be double taxed if we were to just blanket a general county tax. So counties need the ability to be able to form an ambulance tax district similar to the municipalities in New York State.
Well, unfortunately, that's all the time we have for this conversation. We'll post a copy of the state's Rural Ambulance Services Task Force report on our episode page. We've been speaking with Michael Benenati. He's the vice chair of the task force and an Ulster County EMS coordinator. Michael, thanks so much for making time.
Thank you. It's a pleasure to be here.
And we've also been hearing from Aidan O'Connor, a task force member and executive director of the Greenport Rescue Squad. Thank you, Aidan.
Thank you for helping us get the voice out there, because the helpers do need help.
Support for the Capitol Press Room is provided in part by the Lawsuit Reform Alliance of New York. Fraud and lawsuit abuse impact car insurance costs for New Yorkers. Reforms are being proposed to mitigate their impact. Information on these reforms is available at keepnewyorkaffordable.org.